Hi everybody, I'm Andrea Furlan, a physician specialist in physical medicine rehabilitation, and I have a special guest for you today. I have Vanessa Blackstone. She's the executive director of the Pain Psychology Center in Los Angeles. She works with Alan Gordon and all the team that they deliver pain reprocessing therapy that has a randomized control trial published. I'll put the link to the randomized trial in the description of this video below so you can watch. And she'll tell us about what is this therapy. And I'm really also excited because Vanessa wrote the Pain Reprocessing Therapy workbook for people who want to apply this to their chronic pain or other chronic symptoms and sensations. She'll talk about that. So Vanessa, can you tell me, how did you get into this work, pain reprocessing therapy?
It's kind of an interesting, unintentional start. I didn't mean to drop into this work. It was kind of an accident. I started in this work because I had actually deferred on a Ph.D. program, meaning I decided to not go forward with the program that I had applied to because I was dealing with so much of my own chronic pain. The most vivid memory that I have of all of my symptoms at once, which was chronic migraines and headaches, IBS, chronic hives, pelvic floor pain, and neck pain that I thought was causing the migraines. The most vivid memory that I have of all of these compounded was when I was at graduation from University of Southern California. And I was sitting there in this line of all of my peers, and I just wanted it to be over, not only because I felt so bad in my body, but because I wanted to get to the next thing. I just really thought if I just finished grad school that I would feel better, and that meant starting the PhD program. And I had this breakdown with my grandfather telling him that if I can just finish the next thing, I think I'll feel better. And he said, but you've done each next thing and you're still not feeling okay. I think you need to pause and maybe rethink if this is what you should be doing and just take a break and see if that works. It didn't work in the moment yet. It actually made me feel worse, but then it led me to this work. And I discovered this work just accidentally, really, by trying to figure out where I wanted to work next. And there was something about the component of this work of paying attention to an uncomfortable sensation in your body that felt really familiar to me and other kinds of work that I had specialized in. And when I started this work, I didn't realize that it applied to me. I thought my stuff was different. But the more that I learned about the type of people that we see in this population, I started realizing there was something to it. And so I started doing it both personally and professionally at the same time.
And you had studied to be a social worker?
Yes, I went in for my MSW, Masters of Social Work. And with that, I was planning on going into either individual therapy, but I really also wanted to have a focus on something called mindfulness-based stress reduction and utilize that as a PhD focus.
So you got a job at the Pain Psychology Center?
I did.
And then you said, maybe this works for me? I
I was like, I'm going to take a break. I'm not going to do anything for a while. Exactly. And then somebody's like, but we're hiring. Oh, okay, I'll work.
And that's wonderful coincidence.
Yes.
That's very interesting. So you get a job and then the job helps you. So can you tell us how did you start to this? How did you got into therapy? You started working there, but then they started treating you? How did that work?
I know, it seems kind of confusing. So it was a little informal just because as many of my clients, I felt like me and my symptoms are unique. This works for everybody else but me. So when I started realizing that I fit into some of the common themes that I saw within my clients, I would ask a lot of questions to my supervisor, to Alan Gordon, really just trying to understand why I was having such a hard time with how badly I wanted to make this work, not only for my clients, but for myself in some way. And one time I had this session with a client whose symptoms were very similar to mine. Really significant vertigo with this slow increasing pounding of a migraine that started to make you feel nauseous, makes you feel like you're walking on a foam mattress all of the time, and every single sound and light was so sharp, and it felt like it just illuminated the migraine even more. And the client was talking about these symptoms and actively starting to panic about them in our session together. And now it's my job as a therapist to be that resource on the other side, to ground someone in the middle of a tough moment. But the more that they talked about their symptoms, the more panic that I started to feel. My mouth started to feel really watery. The lamp that I had next to my computer felt like it suddenly moved right in front of my screen, and I could no longer see this client. I could only see out of my peripherals, and my panic set in. And then I started to panic when they were panicking. And then I started looking through my notes of somatic tracking, which I know we'll get more into, and trying to read through the ways in which I can ground myself, and it wasn't working. And I started feeling increasingly worse. Now, we just wrote out the rest of the session. And I got to the end and I called Alan Gordon, and as soon as he answered, you know, sometimes when you hear from someone that you know is going to help you, you start crying. It's like a relief. And he answered, and I started sobbing. And I was like, I am the worst therapist ever. I did horribly. And I explained to him everything that happened. And I was like, and then I was supposed to go on a hike after the session, and now I can't because my symptoms are so bad, and I have to close the curtains, and I have to lie down, and I don't know if I'm going to be able to work tomorrow, and just all the fear spiral that we know. And Alan said, well, if you get sick on a hike, I'm not sure that's the worst case scenario because you're already outside. And I was like, that's not what I'm trying to look at. And he's like, well, it could actually be a good thing. Imagine just like being on a hike and just like walking off and throwing up. I'm like, that's what I'm trying to avoid that. And he was like, well, maybe it's a good thing that you didn't do it during your session. It sounded like it felt like you were going to, but you didn't. And I was like, Alan, I wasn't a good therapist in that moment. And he's like, how do you know? Did she say that you weren't? And I was like, no, she didn't say anything. He's like, well, maybe you did do a good job. Maybe you did hold space. Maybe you did help this person. But it sounds like maybe you were feeling the need to fix your own discomfort so that you could fix theirs. And that's when it clicked. And then he said, why don't you just take a second and sit down or lie down? And he guided me through the work that we knew. But my urgency and my intensity to make my discomfort go away had now dialed down. And then when we realized worst case scenario of me going on that hike anyways was getting sick or just not feeling well, the result was, well, I already don't feel well. And if I get sick, I'll already be outside. So I went anyways. And by the time we finished the hike, I realized I did not feel as bad as I thought I would. And then I started realizing I really need to start doing this work for myself. And it just kicked off from there.
That's the pivot moment, right? That you realize this is going to work for me.
Yeah, 100%.
That is very interesting. So what is exactly this work that you did?
Yeah. So this work that we specialize in is called pain reprocessing therapy. The main focus of pain reprocessing therapy is understanding that our brains, specifically our nervous systems, are quite black and white. They say danger, no danger. Danger can be anything from getting an injury, right, falling and hurting yourself. Danger can be walking down an alley at night and you feel somebody walking closer and closer. Danger can also be trying to go to sleep and we suddenly have thoughts about things that we can't control. They all are such different scenarios. One, we're peacefully in our bed at home. Another, we've actually hurt our body. And then another, somebody is coming in and is going to hurt us. Your brain doesn't differentiate. There's no way in which your brain ranks that danger. It just says danger. And sometimes that danger switch gets stuck on. And that can be from a perceived or actual injury. That can be from perceived or actual structural damage to the body. This can also be after a stressful event, real emotional danger that we don't really know how to deal with. We're humans, we don't have a handbook for how to deal with life. It just happens to us and we figure it out as we go. But pain reprocessing therapy focuses on our nervous systems getting stuck on that on switch and has specific tools and language and education on understanding the brain's role in pain, how to learn about the sensations that we feel in our body through a lens of understanding and safety, and rewiring those neural pathways for pain.
Interesting. So you're saying that the brain can be stuck in this danger mode, right?
Mm-hmm.
For something that is like a real danger, or something that is like a perceived danger, or something that we think it is danger, and why and how the brain gets stuck in this, I would call this fear cycle, that this, the spiral, and doesn't turn off the switch, as you said, right? Because whatever was the injury or the damage to the body, it's healed, and now it's being 5, 10 years, 20 years sometimes after, and they are still perceiving that pain. So what happens?
Well, the brain, as you know, is incredible. I mean, it works really hard to keep us safe, sometimes too hard. It's like a helicopter parent. It means well. It's trying to make sure that you're safe, but all you're trying to do is just play on the playground with your friends, and your brain is like the helicopter parent hovering over you, going every time it thinks, not actually, but where it thinks you may have hurt yourself. The brain works so hard, too hard, to try to protect you, and sometimes things that are actually safe for you over time have been conditioned to believe that they're dangerous. Right?
So it's like an attempt of overprotecting, right?
Absolutely. It's that pain-fear cycle. Fear is the fuel for pain. But fear looks like so many different things. It can look like frustration, right? It can look like other levels of fear, like getting incredibly anxious, anticipating something before it's even here. The analogy that I like to use is bracing for impact. Our brain and our body's incredible ability to have reflexes, an unconscious reaction to something that protects us, but the nervous system is capable of bracing for impact when there's nothing to brace for. Again, it's that brain's incredible ability to try to protect you, but it's working too hard.
Yep. I always tell on my videos and my channel, fear is the fuel of pain, especially chronic pain. We use the term nociplastic pain, you use the term neuroplastic pain, but they're the same thing. And that is when the brain is just perpetuating that sensation. And I like that you use the term sensation, not just pain, because sometimes the brain is creating that sensation that not exactly. Can you tell us about what other sensations the brain can also create to protect us? You mentioned you had, was it vertigo?
Yes, I love this point because sometimes when we see the word chronic pain, we think, oh, well, I have like a fluttering sensation in my stomach that's causing constipation or diarrhea, and there's no way that this will apply to me. Or I have a ringing in my ear. It's not painful. It's just this annoying thing that's happening. It's under the same umbrella because there's not a different part of our brain for each and every one of these sensations. It all comes from the same part of our brain. So like my symptoms ranged in severity and ranged in how they showed up. I had vertigo, but I also had this sensation where it felt like I was constantly walking on foam. I also would have this sensation where it felt like both of my eyes were twitching back and forth. I would also have a burning sensation in my pelvic floor, or my stomach felt like it was doing somersaults and I wasn't sure if I had to go to the bathroom or if I was getting sick. All different sensations coming from the same part of the brain. We have folks that have tinnitus, to TMJ, to inflammation, to back pain, everything in between.
I get patients, they have tingling, numbness in the hands, and you examine them neurologically, they're perfectly fine, and you send them to tests, and there's nothing, all kinds of, smell sensations, they're hypersensitive to smells, to light, to taste, to substances that are not dangerous, and for them they have all kinds of adverse effects. So Vanessa, that's very interesting. What exactly are the tools that you use in pain reprocessing therapy? Can you tell us, because I mentioned sometimes in my videos, you need to do brain retraining, you need to do reprocessing of your pain, and then people comment, yeah, but how do I do that? And you just taught us for the past 2 days. it's not rocket science.
Right.
It's not super complicated, but also requires some, some thought and some techniques. Can you tell us, this is the meat of this conversation. Tell us exactly how we can do that.
Yeah, well, the reason it can feel so complicated is because when it's an internal process as the client, or as the provider, when it's so many different symptoms that you're thinking, I don't know how to resolve all these things, it can feel like it's this growing, complicated problem, but it all comes back to the nervous system as the central focus and the central solution. And within pain reprocessing therapy, I have a few steps that I really like to use to just summarize it. We understand the brain's role in pain, learning about us as an individual and our story, why we feel what we feel, what our history is and how it explains how we respond to life.
Each person is different.
Exactly. Understand. And then practice. Pain reprocessing therapy consists of practicing tools such as somatic tracking, which really is just a mindfulness exercise, but consists of describing sensations, paying attention to your somatic experience with a little bit more detail. Curiosity, like playing a game of follow the leader. Your sensations are leading and you're just following. Get to know it before we make it go away. And the exercise consists of actually sitting with an uncomfortable sensation and describing it in detail and revisiting it, following other sensations in the body, what else is happening, and then coming back to the epicenter of pain, gauging it, following it, and this continued practice and pattern. It's best when guided at first, whether you use an audio, whether you work with somebody individually, or you're just watching a video and following along, following folks on social media. It's a little bit easier when you can get familiar by learning through watching and listening. So practicing together. And then the last part is integration. We give tools to our clients, approaches, new methods, new ways of looking at things so that they know, how does this apply to my life? How do I integrate this into my everyday? And then our sessions allow people to keep following up with the integration and practice part, right?
I do have a video on my channel that I recorded. It's a guided somatic tracking. And I did have some patients that I did this because I recommend to my patients, and they came and they said it really works. It's one of the techniques.
Yes.
I only have one video there. But I think this is the key of, the somatic tracking is experiencing that pain. That's how I explain to my patients, experiencing that pain and understanding, changing your brain pathways, that pain you're feeling is not coming from a damaged area, there's no injury there, because I examine them and I can guarantee to them. So it is really important that they get a medical profession to, examine them before, and then make sure that there is no inflammation there, there is no autoimmune disease, that there is not something growing in that part of the body. And if the doctor told you, you're fine, where it's hurting, it's not damaged, it's okay, then it's basically understanding that sensation is just a sensation. That's what I tell them. It's just a sensation, like breathing is just a sensation.
Yeah, I like to tell folks that this work is not about picking one. You're not hurting your provider's feelings if you go and ask your medical provider one more time if we need to make sure to rule out something else. If anything, sometimes we just need to feel like we can check off that box. I have so many clients that have done this work, they understand it, they've practiced, they've integrated, and on their own, they can feel themselves wanting to go back in and go, I don't know if I have to, I've done this before. I don't think I have to do that. Now that's different. That's them catching themselves gravitating towards the usual cycle of trying to fix their discomfort, and because of the work they can catch themselves. But absolutely, I mean, most of our clients have checked off every box.
It's important. And when patients come to us, probably to you too, they already tried a lot of treatments before. And I tell them, if you have a serious condition there, like a tumor, everybody fears like a cancer, a tumor, you're not going to block that pain just by thinking differently. That pain is going to come back. that pain is not going to be, you'll not be able to decrease a pain from, you have a fracture, and just by the power of your mind, not feel that pain. Some people do some mindfulness and hypnosis, they're able to reduce that suffering from pain. But doing this therapy, somatic tracking, I have seen people that they can control what they're feeling in their body just by thinking differently. So therefore, the pain is only coming from that sensation created that you are defining as pain, can only be coming from the nerve system, the brain pathways, the emotions, right?
The way that I think about this work is like couples therapy with you and your brain. Something happened between you two. Maybe it felt like one was...
Like if you're married,
yeah,
your body is married to the brain,
exactly,
right?
Exactly.
I love that.
Yes.
And then you have to do couples therapy because you cannot divorce.
Correct. Something happened. You two are not working well. You cannot stand to be in the same house or the same room with each other, let alone the same bed. And we haven't been working for a while. But unfortunately, this one, we can't just divorce. Like you said, we can't say I'm moving on. We're kind of stuck with it. And that's when we feel really stuck and anxious and depressed, and why we want to solve it even more. But pain reprocessing therapy is like couples therapy in that we're trying to get the two of you to communicate better so that you can coexist, so that it feels like you're working with each other instead of against it.
I love that. It's such a nice analogy. Yeah, working with it. So how can you work with your pain? Like some people hear this and say, no, I can't live with my pain. My pain is killing me. I'm suffering. Nobody can live with pain. Is this a pain management? Is this a way you're teaching me to live well with my pain? Is this what you're saying?
You know, the way that I love talking about this is using two terms, urgency and intensity. When we are in pain, it spikes up our nervous system's response even more to now try to urgently make this go away because, again, that perceived danger. And we treat the going away with a sense of intensity. It's like we're often trying to control our pain. And what this is like sand in the palm of your hand. You scoop up this sand and you're trying to control it. But with sand, the tighter that you squeeze, the more that you lose and at a faster pace. This work is trying to teach folks to loosen their grip. Now, that doesn't mean accepting it and just dealing with the fact that they're going to be in pain forever. This is why we're rewiring the understanding of the brain's role with pain, applying somatic tracking and other modalities or other exercises within the modality to get us to respond different, to teach that overprotective nervous system that it can calm down, that it does not need to be sending these signals in the first place. Or the signals can maybe be a 1 out of 10 instead of a 10 out of 10.
Okay, Vanessa, I need to ask questions here because there are many questions in my mind. So you're talking about eradication of the signal. So not just living with that pain and becoming friend of the pain and pain management. It is possible to eradicate that, right? Okay, so that's one thing. It's possible with brain retraining, with reprocessing, to eliminate the fuel of pain and cut the fuel, whatever was generating this fear in the brain, and then the brain says, okay, I don't need to create this sensation anymore. Okay, so that's one thing. But what if, I have a lot of people that will ask this question, what if they have we call, in my channel, I talk about nociceptive, neuropathic pain. These are conditions that are always traumatizing. Like think about an autoimmune disease that you are producing antibodies. An example is rheumatoid arthritis or ankylosing spondylitis that affects the spine. Fortunately, they're rare. But and there are many other conditions, neuropathic pain, like there is a nerve compression or a nerve injury or a diabetic neuropathy, that the diabetes is always affecting the nerves. What if they have a structural problem causing a damage in their body? How would this work? They cannot eliminate the sensation of pain just by thinking differently about the pain, because those impulses are coming from the nociceptors, the neuropathic, they are activating the pain areas in the brain. So how would this work?
The first stop I like to make with this conversation here is talking about abnormalities in the body, what's normal and what's not normal, right? Normal abnormalities is a term that I've received from Dr. Howard Schubiner, who is a big head honcho in this work and a huge mentor of mine. Howard's always talked about normal abnormalities showing up in the body. All of us are going to have something in our body when we get imaging done. That's just how it is, right? Yeah. There's even this wonderful asymptomatic study that gathers a variety of different participants, categorizes them by different age groups, and shows between each age group there are deteriorations that happen in the spine.
And
but
they don't mean
exactly.
I just did a video about that. I'll put a link here.
Wonderful.
Explaining that MRIs sometimes are useless because they show what you just called normal abnormalities. I love that.
Absolutely. And I use that as a tool with clients too, when they're like, no, but I have something in my imaging. It's like, we're not saying it's not there. You're not making it up. It's not a facade. It's really there. And I know that the emphasis has been, well, this is probably what's causing your pain. But there is actual research that shows us people live with so many things in their bodies all the time. And it doesn't mean that they have to have pain or that intensity of pain. Yeah, so I like to focus on that first and say, well, there is research that shows us that there's abnormalities in all of our bodies. But what if we're actually dealing with something that is really going on? I've had many clients actively in chemotherapy treatment. I've had many clients having gone through horrific physical injuries or actual diagnoses like rheumatoid arthritis. This work can still be helpful because we have to talk about amplification of symptoms. The brain's ability to take a symptom that is already there, let's say at a 2 or a 3 out of 10, attach a metaphorical hearing aid onto that sensation, and because of our learned responses, our childhood experiences, the things that we're told about that sensation, the imaging exams, the uncertainty of the future. It's like attaching a hearing aid, and a hearing aid's job is to amplify volume. So it dials it all the way up. So that sensation that maybe you would get at a 2 out of 10, you're now getting at a 10 out of 10. And PRT can help not only dial that down to a 2 out of 10, but I have had RA clients that end up coming back and saying, I noticed that, my body gets a little irritated, but they don't even associate it as pain. They just associate it as a personal limitation and maybe a need for some breaks and self-care, and their relationship with it. Again, that couples therapy has completely changed.
In my channel, I talk a lot about central sensitization. That's the method, how the body amplifies that sensation. It's a biological method. And I tell my patient, you're not making this up. You're not imagining. Your pain is real. Central sensitization happens. And when she talks about the fear, it's not your fault. You're not making this up. It's your brain trying to protect you. And it's overprotecting. And even the central sensitization that can happen with a rheumatoid arthritis, an ankylosing spondylitis, autoimmune disease, or any structural problem can be treated with this. When I have a video about central sensitization, and at the end they said, you can turn down with brain retraining. So now you're learning more, a technique how you can turn down the dial.
Absolutely.
So Vanessa, I think the question everybody has in their mind. So if you do this, you will never have pain again. You will be cured, and you will be able to erase all the pains and all the bad emotions that you have in your head, and your life will be perfect forever and ever.
In the beginning, I think it's so understandable to want that. I just don't want to feel anything. I don't want to have to deal with pain. Something that takes a while to learn is actually being really grateful for your pain. And when I say that, I'm not saying you're elated when you're in pain. You're not like, yes, it's here. You're more of like, oh, I've learned how to listen to this in a way that feels more empowering, rather than feeling like it was taking away my sense of self. So having any kind of sensation, whether it's related to sensations that are familiar to you, or whether it's related to a stressful event and you're just feeling the impact of that, we need pain. We need it. We need it so that we know our brain saying, can you please pay attention to me? I need you to listen to me. And we need to listen to that little flag that is popping up, but respond with less urgency and intensity, respond with less fear. So our goal is to get you to change the way in which you respond. That's the focus of pain reprocessing therapy, and we will have sensations down the road, and that's going to be a part of many different causes, but how we respond to it is everything.
That's great, because I have so many people that their main fear is, I'm going to have an episode, a flare-up, a setback when I have a plan, like I'm going on vacation, or I have the job to do, I have to take care of my kids, my grandkids will come home, and they feel powerless because the pain controls what they do. The pain controls their agenda, what they can do, what they cannot do. If they have an appointment or something important in their life, they will cancel because they are in pain. So now you're saying that if pain comes back, and it will come back, pain or sensations, they now have control over that episode.
Absolutely.
I think that's amazing, because I think people don't understand. People with chronic pain, they don't understand this is possible. You are hearing from someone who has done this. I think, have you had an episode that the pain came back and you were thinking differently, and then were you able to control and that pain went away, so it didn't destroy your plans?
Absolutely. I always thought that my big selling point with this work was to say, well, I have been symptom-free for about 4 years. I used to always say that to people. All of my symptoms, I have been symptom-free for 4 years. And I would say that with such pride, not realizing that there was another way to be proud. So there are two things that we can be mindful here: setbacks and extinction bursts.
What's the difference?
Yep, a setback is actually more of a mindset. When we have pain, it feels like we've taken 10 steps back, especially when you've been doing well for a while or getting some traction on this work. The pain comes back. It just feels like you've fallen off.
You lost everything.
Lost everything. You're back at square one. And that's understandable. But remember, we're still trying to change the way in which we respond. What we try to reframe that thought of setback as is an extinction burst. And an extinction burst is a burst of the behavior that you're trying to extinct. The difference between the two is a setback is based on fear. An extinction burst is a part of the process. You are going to have a sensation at some point when you're trying to extinct it. It's your brain's way of engaging in its old habit, its old neural pathway that you're trying to rewire. And it's like your brain going, do we need that? Are you okay? Are you sure? And I 100% experienced this myself. I had the worst migraine a year and a half ago, and it slowly started creeping in. The sensation in my mouth where I was starting to feel it watering, like I was going to be sick. The slow creeping in, like steady pounding in the center of my head. Starting to feel like everything that I was walking on was really uneasy. And every time I would make any sudden movement to the left or right, it kept spinning in that direction.
It's coming back.
Luckily, I had a really good friend who was encouraging me to take a break. She had to maybe say it like 5 times. She's like, just take a nap. I am fine. You don't need to take care of me. Go lay down. Leave me be. You take care of yourself. And it kind of hit me after a little bit. But what I realized the next day, when I went from a 10 out of 10 the previous day to a 1 out of 10 the next day, I realized, oh wow, I didn't cancel my whole week, which is what I would usually do. I didn't blame working on the workbook as a part of what caused this symptom to come on. I did have moments where I was getting really frustrated and fearful, but I felt awful. Like, of course I would. I didn't feel good, and my head was just blaringly in so much pain. So naturally, I'm going to get frustrated. That's okay. But I didn't engage in my usual panic pattern. And the next day when I realized that, my wonderful colleague who you met, Giovanna, she asked me, is the 4 years more of a learning experience, or was that the learning experience? Was that your aha moment? And I said, having the symptom and realizing that I was capable of responding differently, like I didn't even engage with the fear that in the way that I usually do, that was so much more worth it. And I use that story now instead of, well, I've been symptom free for years. It's become such a pivotal moment of my own recovery.
You changed the way your relationship with the episode. Can you repeat again, what is an extinction burst?
An extinction burst is a burst of the behavior that you're trying to extinct. And that one is a part of the process.
What was the behavior you were trying to extinct in your case?
In my case, the behavior that I was trying to extinct initially was having the migraine at all, having the symptom in general. But what I really realized is the behavior that I was trying to extinct actually is not engaging in the urgency to solve my pain, to make it go away, to squeeze it to death, or to power through it. My friend reminded me to stop powering through it. Usually I would just kind of push through it anyways.
So it is okay if a person is having an extinction burst to take it easy, to do the soothing, whatever works for them. They can go for a hot pack.
Absolutely.
They can go for a walk. They can go do a meditation, go for a massage.
Anything.
Whatever suits them and calms down the nervous system to show them that they are safe.
As therapists, we're taught something in grad school, and I use it on myself and clients, and it's probably the most profound lesson that I was ever given, is meet yourself where you are at. Meet your client where they are at. If we are not in a place to go, okay, I need to do my somatic tracking, and you maybe just need a nap, take the nap first, and then see if you need somatic tracking. And remember that you didn't fail or let anyone down. You actually listened to yourself for the first time. And again, I had this friend that was trying to really get me to listen to myself, and I'm so grateful for her because now I realize what I tend to do.
I know sometimes people in this situation, they go for a pill. They go for a painkiller. And then they sleep, and then they wake up, they say, I'm better, therefore the painkiller worked. But I would say that's more like a band-aid to the situation, because you just took a painkiller, slept, woke up, you were a little better, maybe your pain went away. But then you didn't listen to your body, you did not communicate, like the couples therapy, to see what was it your body was trying to tell you. Maybe you are too stressed. Maybe you are trying too much. You're trying to please too many people. You cannot say no. You can't set boundaries. These are all things that your brain is trying to tell you. And if you don't listen, it will continue creating those sensations, right? That's what I learned in the course. Okay, Vanessa, I know some patients will say, no, this is not for me because I don't have any psychological problem. I already did therapy. I don't have any trauma. I don't have any past trauma. My life is wonderful. I have a high pain threshold. I just have pain in my body and treat my body. You don't need to talk about my emotions, my brain, my mind. What would you tell them?
A lot of times it's kind of like symptoms where people feel like, well, ringing in the ears is different than back pain. You don't have two separate parts of your brain for that. It comes from the same place. Well, psychological versus physical, they're different. They're not. It comes from the same part of your brain. That's why the treatment is the same. A lot of people come into this work with not much to their story, meaning there's no significant big T trauma events that are catastrophic life events. Sometimes little T trauma events, meaning just inconsistencies in life in some kind of way. But some people come with none of that and enjoy their life and really want to get back to it. The pain itself can be the big T trauma. The pain itself can be the foundation.
So stressful.
So stressful. And it can come on because our brains, regardless of a history of trauma or not, a history of depression or anxiety or not, our brains are still capable of getting stuck on the on switch. Your brain works so well, it works too well. It's dialed up and we're trying to dial it down.
So now I have to ask you where people can find this kind of therapy. I know you have I was trained by her 2 years ago, and you have trained a lot of professionals in pain reprocessing therapy. So where can people find a person, a professional, coach or counselor that can do this type of work? And talk about your new book. She has a new book that she wrote for people like you.
Yes. So we do have a very large center based in Los Angeles, but we do work out of state and out of country. The Pain Psychology Center, you can reach out through our website, calling in, and our intake coordinator's turnaround is pretty fast, about 24 hours. We offer a free intake, and then we'll get you matched with somebody that best meets your needs.
I'll put the link of the Pain Psychology Center in the description of this video below.
And if it doesn't end up working out, which does happen, we send you as many resources as we can and help you find someone in your area, because we do have a large directory of folks that have been trained, which is the benefit to everyone learning about this work, so that we can send you to someone that is in the same world of utilizing this modality.
And this can be international?
Yeah, absolutely. I believe we have just about every country covered, I think. And so if you can't if you can't necessarily start with somebody right away one-on-one, or don't want to, that's okay too. Or just want to learn about it first to see what can work for you before you get started, or if you get started at all. That's why we wrote this workbook. I mean, it was written for the purpose of giving you a tool so that you can navigate this on your own to see where you're at the end of it. This was co-authored by myself and my wonderful co-author, Olivia Seneko. She works at a tribal health organization in Alaska, where she leads their chronic pain group and sees folks individually. And actually, most of the exercises in the workbook she wrote. She's got that knack for patience and compassion that I know that I have, but it's just something about the way that she writes is so much better. I think she used to be a lawyer, so I think that's her writing is top notch.
She's a recovering lawyer.
Yes, she's a recovering lawyer. That's what we call those that used to be a lawyer and now therapists or clinicians. Yes. So the whole purpose of this book is to give you practical education and tools. Like I said, understand, practice, and integrate. This is to understand. We give you things that you can practice. And then we want you to start figuring out how to integrating this into your life.
Amazing. And the other book also that we always recommend to people is Alan Gordon's book, The Way Out. So you get all these resources in the description of this video below. Vanessa, thank you so much for talking to me today. I hope this will help many people with chronic pain who will watch this video. Don't forget to leave your comments in the comment section here. Don't forget to subscribe to this channel. And please remember, we're not here to give you medical or psychological advice or counseling. This video is for educational purposes only. And if you're having any emergency situation while you're watching this video, please go to the nearest emergency department or call an ambulance. Thank you so much, and thank you for watching today. Goodbye.